Hi guys, my name is Chandru and welcome to my topic diphtheria. So let's go to the session. So diphtheria is an infectious disease caused by the bacterium Corynebacterium diphtheriae. It is an upper respiratory tract illness characterized by a sore throat, low-grade fever, and an adherent membrane of the tonsils, pharynx, or nose. So the causative agent, Corynebacterium are gram-positive, aerobic, non-motile, rod-shaped bacteria related to actinomycetes. They form irregular shaped, club-shaped or V-shaped arrangement in normal growth. So the classification, this is the classification for the bacteria Corynebacterium diphtheriae. So the transmission, the incubation period is usually about 2 to 5 days. The transmission occurs by droplet spread through contact with the patient or carrier or articles with the discharge from the infected lesions. Humans are the primary reservoir for the Corynebacterium diphtheriae. Sources of infection include carriers who already recovered from the infection. The organisms are inhaled and they establish infection in the upper respiratory tract, usually in the nose or throat. So the signs and symptoms are fever of 30 degrees Celsius, bluish skin coloration, that is the cyanosis, sore throat, hoarseness, cough, headache, difficulty in swallowing and breathing, foul smelling, blood-stained nasal discharge. So the pathogenicity includes two distinct phenomena, invasion and toxogenesis. The invasion of local tissues of the throat which requires colonization and subsequent bacterial proliferation. The diphtheria toxin causes the death of eukaryotic cell tissues by inhibition of protein synthesis. In upcoming slides, we can see about the protein synthesis. So the toxinogenicity have two factors which influence the ability of Corynebacterium diphtheria to produce diphtheria toxins. That is the low extracellular concentration of iron, presence of lysogenic prophage in the bacterial chromosome. So this is the mode of action of diphtheria toxin. So the diphtheria toxin has two subunits. One is the A subunit, which is the active site, and B subunit is the binding site. The orange here you can see the orange color is the A subunit, and blue color is the B subunit. When this diphtheria toxin, which binds to the receptor of the host cell, when it binds with the host cell, the diphtheria and the toxin and the receptor will enter into the host cell via endocytosis. When it enters into the cell, the catalytic A subunit cleaved but remains attached to the subunit B because of the disulfide bridge. As the endosome vesicle acidifies, the disulfide bonds are reduced and the A subunit is released into the cytoplasm. As the A subunit is released into the cytoplasm, the A subunit releases the enzymatic domain into the cytoplasm. The enzymatic domain then catalyzes the transfer of an ADP riboslase which go from the NADP plus to the eukaryotic translation EF2 factor, that is the eukaryotic elongation factor 2, which inhibits the protein synthesis and leads to the severe symptom of diphtheria. So the diabetic diagnosis is by collection of specimen. So there are two cultures, one is the nasopharyngeal culture and throat culture. So the presumptive diagnosis. So by naked eye we can see the diagnosis by pseudo whitish membrane of the tonsils. Here in the picture you can see the tonsils. We can see the grayish pseudo whitish membrane of the tonsils. So the diphtheria produces grayish colored colonies on blood agar and telluride blood agar. The other features are Chinese letter arrangement, lips basally, metachromatic granules, growth observed in the Loeffler serum slope, black color colony in the telluride blood agar. So the treatment is by administration of antitoxin is the most important factor in treatment and must not be delayed till bacterial confirmation. So the antibiotics are commonly used. They are erythromycin, IM penicillin, benzanthin, and penicillin in a single dose. Benzanthin penicillin in single dose. So the prevention, the diphtheria toxin is recommended for all persons at 2, 4, 6, 18 months and 5 years. So given as DPT triple antigen, and at 15 years and every 10 years thereafter given as ADPT. Booster doses of DPT vaccine should be given to high risk populations and high health workers for at least 10 years. So these are the reference for diphtheria. Thank you so much for the session.